Our typical patient, I think, really is the person that has been to see a million doctors. They've had all the tests under the sun and they're not getting a lot of answers. So functional neurology takes the parameters of traditional neurology and kind of tightens them up. So we're looking at how the brain, parts of the brain, pathways in the brain, how everything's communicating with each other and what that means in terms of your overall function, health, and the symptoms that you're presenting with.
The foundation of what we do is built around the idea of neuroplasticity. Our brain has the ability to change and adapt and grow new connections throughout our life. Neuroscience used to think when you were born, the neurons you had were all you had, and then it was just downhill from there. Now we know that your brain is changing throughout your life based on your experiences. Every time you see a patient, it's something different because we get to treat them for the individual that they are and not maybe the diagnosis that they may or may not have. So we're able to use this idea of neuroplasticity to create very specific changes for patients' brains and allow the brain to heal itself.
The most common things that we deal with in our patients, especially with the kiddos, is more ADHD and emotional regulation issues. In kind of our mid-age, a lot of concussions, dizziness, chronic migraines, autonomic dysfunction. And then our older patients, a lot of movement disorders, dizziness, Parkinson's, MS, those types of conditions.
When a patient first comes to Carolina Functional Neurology Center, we will do a complete physical and neurological exam, and we'll run various diagnostics to look and assess the functionality of their brain. We also will run a complete comprehensive metabolic panel to assess their lab work as well. And then we want to put all those pieces together to try to come up with a very individualized care plan for each person.
I think the biggest thing that I want people to know about us and when they come to Carolina Functional Neurology Center is that we are here to listen to them. I want them to know that we hear them. We try our best to make sure that we don't overlook any of those things that the patients are telling us about themselves, about their health history, about the symptoms that they have, and what they go through on a day-to-day basis.